the last hour or so, we've got this new study around something that you might have heard of, you might have done, you might be doing yourself, called intermittent fasting, IF. And it finds that it may nearly double the risk of dying from a heart issue. So remember, this is a kind of diet where you only eat like at certain times a day or within a certain time window. This study examined its impact on 20,000 Americans, the whole thing, raising some red flags about what's become a pretty popular way for some folks to try to lose weight. Now, the authors of this study say that fasting for 16 hours or more every day, in their words, significantly increased the risk of some kind of a heart disease-related death. I want to bring in our medical contributor, Dr. Kavita Patel for NBC News here. There's a lot of studies out there about IF. We've covered them. Some of them say no material impact. This one clearly says there's more of a risk. Other studies have said it's actually good for heart health. It reduces inflammation, etc. There's a slew of those kinds of studies. How are we supposed to think? A person without a medical degree, what are we supposed to do?
Yeah, Hallie, so the most important thing to kind of put in context is it's a presentation at the American Heart Association. That doesn't diminish, but it's not a peer-reviewed journal article quite yet, and there are a lot of caveats to it. The most important caveat is that this was self-reported data on 20,000 people. That's important, but it was based on...
Because that's a lot of people.
It's a lot of people, self-reported on about 2 days of their diet kind of pattern. So I'm not saying that they didn't always follow like an 18-hour off eating and an 6-hour or 16-hour off and an 8-hour eating window, but
and by that you mean people would say I'm only going to eat from 11 to 7 today, and I'm not
self-reported. Right. So anytime it's self-reported, you have to take it with a grain of salt. And then number two, we don't know about what these people ate. So for all we know, people were eating pretty bad food, and it doesn't matter when you eat bad food, it's bad for you. So we need to look at the quality of the food and other factors that affect diet.
Okay, but can we make an assessment as medical professionals, which I'm not one, but can there be an assessment made on intermittent fasting? Does it work? Is it good, or is it problematic?
Right. So I think for all people, intermittent fasting should be done with personalization. So if I were to walk out and say to every patient who needs to either have a better diet, needs to modify their heart risk factors, you should do intermittent fasting, I would be negligent as a medical doctor. What I should say is, how can we help you eat better? Because Hallie, if it helps you to eat better by only eating in an 8-hour window, and you're going to get more fruits and vegetables, it's what you eat, not necessarily when you eat. There are several probably smaller groups of people, certain ethnicities perhaps, certain genetic subtypes, where the time you eat matters, but for the most part, the majority of people, what you eat matters. It's what you put in, and that's what really matters.
Do you think there's been enough studies, enough research done on IF to be able to make some of those clear assessments?
I think there's been enough studies to show that there is no one diet that can solve them all. And I think that what we should do is not get so stuck on the type of diet, but start talking about food. And food deserts are real. People can't afford healthy food. People don't know how to make affordable food for their families. That's a much better conversation than, is it 16 hours on or 8 hours off, 2 days on, 5 days off. And I've seen some dangerous eating patterns when people get stuck with those habits and they're neglecting calories. I've seen people actually eating too little, and this is one pearl. The people in that 20,000 found that they had less muscle mass. That just tells you they're probably not getting the right amounts of protein and macronutrients, which is very important.
So important, so interesting. Dr. Patel, come back anytime because we will have that conversation, as you know. Thank you.
Thanks for watching. Stay updated about